Topic today will be about the top 10 supplements for longevity. And if you want a reference, this is one of the references. You can go to vitalitymagazine.com and you can basically in their search engine put super nutrients for longevity. And most of what I have to say can be found there or in this particular lecture or this particular article, Reversing Chronic Inflammation. So just go to vitalitymagazine.com and you'll be able to find anything that I'm going to be speaking about today. So the topic is about longevity, how we can live longer and more healthy. And basically, as this slide illustrates, these are the key tenets of aging and illness. So what you want to control is, as much as possible, oxidative stress and inflammation, hormonal balance. You want to control your stress hormones. You want to control glucose and insulin regulation. That's very important. You want to balance your immune system. You want to control the environment to a degree where you are not chronically exposed to toxins. And you want to do the best for your biochemical individuality. Now, so the question is, should you be taking something that lengthens your telomeres? There's a product called TA65. Have any of you heard of this? Yeah, it's very heavily advertised. The trouble is that a 6-month supply of TA65 costs between $1,200 and $4,800, depending on how many capsules you take each day. They usually tell you take 1 or 2 capsules. But in a company-funded study, the average telomere length didn't change in 13 older men and women who took TA65 for 12 to 18 months. So the bottom line is that it's not clear whether you can do anything to lengthen your telomeres or whether that would stave off disease or help you live longer, because in actual fact, what controls a lot of how long you will live is not your telomere length, but the degree of inflammation you have in your system. So if you can control inflammation, you can usually live longer. And it's been found that people that live to be over 100, they tend to have the least amount of inflammation in their system when you compare it to people that are a lot younger who have a lot of inflammation and don't live as long. So how can we do this? Well, first I think the most important thing is to start with food, and you'll hear a lot about this during Whole Life Expo. There are certain foods that will help eliminate inflammation or reduce it at least, and then there are other foods that cause inflammation. So you can see on the far right, gluten, casein or dairy products, processed meats, a lot of fried foods, lots of meat and dairy products, sugar, fast foods. All of those tend to produce more inflammation, while fruits, vegetables, and certain things like olive oil and spices like turmeric, ginger, onions, garlic, those tend to reduce inflammation. Ancient predator, modern predator. I'll tell you why later. This is a slide that illustrates the amount of sugar that you find in a soft drink, like 10 teaspoons of sugar per can of Coke. And then if you get larger slices, you get larger amounts of sugar. New research exposes the health risks of fructose in sugary drinks. This is something that was published very recently. And 1 or 2 sugar-sweetened beverages a day had up to 26% increased risk of developing type 2 diabetes, a 35% increased risk of developing heart attack or fatal heart disease, and a 16% increased risk of stroke. And not only that, but if you drink carbonated beverages, you have a much greater chance of developing a cardiac arrest. And that's something that was published in the European Society of Cardiology journal. On the other hand, how many here think that coffee is a bad thing? If you drink organic coffee, it's been now proven that 3 to 5 cups of coffee can reduce a lot of illnesses and actually make you live longer. This is according to research done at Harvard. Basically, the benefits include a lower risk of death from cardiovascular disease, neurological disease, type 2 diabetes, and suicide. So something about coffee that allows you to live longer. And of course, obesity is something that is equal to inflammation. So people that have problems with weight control usually have a lot of inflammation in their system. So it's important to take a look at that, as well as gluten. Had a gluten-free salad for breakfast today. My son gave me this slide and he told me to mention that he gave it to me and that he thought it was funny. Okay, how many here think that if you consume artificial sweeteners, you're better off than if you have like highly sugared beverages? So for example, is Diet Coke really better for you than regular Coke? How many people here think that those artificial sweeteners are better for you? Anybody? You do. You don't know. Well, actual facts are that if you look at the incidence of type 2 diabetes, the artificially sweetened beverages will create a greater incidence of type 2 diabetes than the sugar-sweetened ones. So this was based on a study that was done in the American Journal of Clinical Nutrition in 2012. So these are the best sweeteners. If you're going to use any sweeteners at all, I usually recommend that people use coconut, sugar, maple syrup, stevia, xylitol, and even honey. These all have a much lower glycemic index than regular sugar or table sugar. And the worst sweeteners are aspartame, sucralose or Splenda, fructose, and agave. Agave syrup has been touted as a good replacement for regular sugar, but it's very high in fructose, so it has a very high glycemic index. Sucralose or Splenda, people think that Splenda is safe. Well, in actual fact, there were only 2 human studies ever done on it, and the studies done in animals showed things like anemia and infertility problems, enlarged and calcified kidneys, and spontaneous abortions in rabbits. So it's not exactly safe for animals, and the only studies that in humans that looked at it were looking at tooth decay. And yes, it prevents tooth decay, but seriously, the study lasted for only 4 days. So it's not very good. High fructose has been linked to obesity, metabolic syndrome, insulin resistance, type 2 diabetes, hypertension, hyperlipidemia, high triglycerides, arthritis, gout, and even cancer. And the day after Halloween, Batman unfortunately consumed too much fructose. So what about fats? Fats, in general, there are some really healthy fats that help us reduce inflammation, and they would include the kind of fats that you find in olives, olive oil, coconuts, coconut oil, and even butter. Butter actually is a good fat. Raw dairy, if it's unpasteurized, if you can get that, raw seeds and nuts, eggs, those are organic, by the way. Grass-fed meats and fish oil, but not the fish. The reason for that is because fish are contaminated with mercury, and in Canada, by law, you have to remove the mercury from the fish oil capsules before you can put it on the market. These are the worst fats. These are the ones that create or increase inflammation. They would include things like margarine and soybean oil, which is all GMO. Palm kernel oil, hydrogenated and partially hydrogenated fats, and so on. Margarine, by the way, under the microscope looks exactly the same as plastic does. So it's akin to plastic. So putting that in your system will probably cause you to age a little quicker. What about wine? A little wine daily, Antonius, leads to longevity, perhaps as old as 35. So a little bit of wine is probably okay because of its content of resveratrol, which is a natural antioxidant. So it can probably make you live a little longer, but if you drink too much, obviously that's a problem. What about gluten? A lot of people say if I cut down on my gluten, that would probably help reduce inflammation. It may help a little bit, but in order to get the maximum benefit, you really have to get off of it completely, according to this randomized double-blind placebo-controlled crossover trial, which is what everyone asks for. You can see that even 1 week of eating a little bit of gluten can significantly produce problems with symptoms and actually produce more inflammation in people than the placebo group got. And of course, saturated fats, the bologna, salami, cold cuts, and fried foods, all of those tend to weaken the immune response, and because of that, decrease our ability to live longer. Now, even Harvard School of Medicine, Public Health has come out and said that eating fruits and vegetables with high pesticide residues have been linked to illness, have been linked to poor semen quality, and God knows we don't need that. Get them while there's no causal link to cancer. There's a problem with hot dogs. The University of California Medical School did a study, and they found that children eating 12 hot dogs or more per month have 9 times the risk of developing leukemia. And part of that may be because what is a hot dog? Hot dog is a combination of multiple organs from multiple sick animals, carcasses from old or thin cattle and swine cheeks, jowls, hearts, tongues, lips, eyelids, windpipes, testicles, pancreas, bone, etc. All of those are found in a hot dog. So another thing, when you follow an anti-inflammatory diet, you are basically reducing the amount of acid formed in your system, and you're basically creating more of an alkaline medium. Almost all disease occurs in an acid medium, and a lot of disease is helped by making the body more alkaline. So you can do that by eating more of the alkaline forming foods. And so those are basically fruits and vegetables, and you want to avoid as much as possible the meats and the grains. Grains and meats and sugar tend to be more acid forming. So as is soy, for example. Soy products are very acid forming. So most people can't live like that. So I usually recommend that people consume about 80% of their food as alkaline forming and 20% as acid forming. We want to give an award to Monsanto because they received the 9th annual Rubber Dodo Award this year. And that's because of their promotion and use of the pesticide glyphosate, which has created a lot of inflammation over the years without us really knowing about it. This is from the Center for Biological Diversity. So I'm advocating as much as possible that people eat organic food, because organic food does not contain these pesticides, doesn't contain these pro-inflammatory ingredients. And as this slide says, yes, organic food can be pricey. However, last I heard, illness was quite expensive. There are some side effects to eating, this kind of diet. One of the major side effects is, as this slide illustrates, you're eating too much fiber. So Julie Daniluk, who was just here a minute ago, she wrote a great book called Meals That Heal Inflammation, and I recommend this a lot to help people sort out their diets, because what she is recommending is basically what I feel is correct and will help you live longer. Now, what about supplements? A lot of people say that supplements are dangerous. I'm sure some of you may have seen the CBC documentary, The Fifth Estate, and they were saying how terrible supplements were and that there was no proof, and that these things are a fraud, that they don't contain what they say is in the label, et cetera, et cetera. They put down Linus Pauling. They made fun of fish oils, vitamin E, vitamin C, just about anything out there they put down. And, in actual fact, they missed everything to do with, all of the studies that have been published over the years. One of the things that these critics are very, very much talking about is the toxicity of vitamins. But if you look at Poison Control Center data for the past 27 years, there have been a total of 0 deaths from any approved or unapproved nutritional supplements, while with prescription drugs, each year there's about a minimum of 106,000 people that die from properly used, properly prescribed and monitored prescription drugs and non-prescription drugs. For example, Tylenol kills about, they estimate about 68 people a year in Canada, and is the #1 cause of liver transplants in North America. So if we look at the safety issues of supplements, they are highly safe. And in terms of toxicity, it's pretty much zero. So let's look at what are the best supplements to take to live longer. And these are my top 10, and I'll go through the reasons as to why I think they are. The first one on the list, and I think the top one, is glutathione. Glutathione is the body's master antioxidant, and it is composed of 3 amino acids, L-glutamine, L-cysteine, and L-glycine. Now, when you swallow glutathione in the past, what's happened is that the stomach acid would break it down and you'd lose the effectiveness of glutathione. But nowadays, they've been able to make a type of glutathione that does not break down in stomach acidity and absorbs in whole. So it's the most important antioxidant in the body. And as you grow older, you make less and less of it. Generally, it's made in the liver. And as you grow older, you get more and more illness. And it's been found that the more illness that you have, and these are some of the diseases that have been documented to be associated with low glutathione levels. You can take anyone with any kind of serious illness, and if you measure the amount of glutathione in their system, you will find that it corresponds, the low levels corresponds to the degree of severity of the disease. And here we're talking about primarily neurological diseases, cardiovascular diseases, immune system problems, cancer, thyroid and pancreatic function, and other inflammatory conditions. Glutathione is anti-inflammatory. It's an antioxidant that prevents a lot of aging of all your tissues. One of the ways that you can see how glutathione works in your system is if you can increase the amount of it, it will improve your muscle fatigue after prolonged exercise. So there are studies that have been showing that this will help any kind of athletic performance without giving you any kind of steroids. So this is from the Journal of Sports Medicine, International Journal of Sports Medicine, that did a study showing that if you can raise the glutathione levels, you will improve athletic performance. Interestingly enough, glutathione, if you inject it, a lot of people are using it to whiten their skin. In Asia, this is a very popular treatment. You get intravenous or intramuscular injections of glutathione, and gradually over a period of time, it gets rid of brown spots, age spots, and any kind of hyperpigmentation. I myself, I've been getting glutathione for about a year, intravenously once a week, and I used to have like age spots on my face. You could look at old pictures of me and you could see them, but they're gone. And generally speaking, I've seen this happen in dozens of patients who get the glutathione intravenously. But nowadays, you can get glutathione orally and it will absorb. The name of the product that is sold to the various supplement companies is called Cetria glutathione. And studies show that it has a very high absorption rate. So you can take this product and it can actually get into your system. So this is something that you can use to make yourself basically disease-free as long as possible. So it is possible to swallow this and get a good result. The second most important thing that I can most important supplement that is pro-longevity is vitamin D. Now, the Fifth Estate show panned vitamin D. They totally ignored about 1,000 different studies that show how it can make you live longer. They completely ignored that, and they said that dosages over, I think it was over 1,000 units or 600 international units were toxic, which is complete rubbish. Vitamin D is one of the most potent cancer inhibitors. That's been, even Health Canada admits that. This is just to illustrate that you can't just take a whole pile of supplements and have a lot of bad habits like smoking and drinking and smoking cigars and so on. And this lady here is actually 24 years old. Okay, so how does vitamin D work for cancer? Well, if you want to get scientific about this, this has been published everywhere. This is even as early as 2004. Vitamin D has been shown to increase cell differentiation, increase apoptosis, which means cancer cell death, decreases proliferation, decreases invasiveness, decreases metastatic potential, and decreases angiogenesis. Angiogenesis is basically the formation of blood vessels that will allow the cancers to spread throughout the body, so it inhibits that. Unfortunately, vitamin D in Canada, we can only get it through the action of sunlight for maybe 1 or 2 months a year. The sun is not high enough in the horizon to create the vitamin under the skin. So we have to get it from either food or from supplements. And unfortunately, food supplies are not that high in vitamin D. So we have to get it from a supplement. Now, vitamin D has been shown to be an antibiotic, a natural antibiotic. And the reason for that is because when you take high doses of vitamin D, you will increase the production of a protein called cathelicidin. And the higher your cathelicidin level, the higher vitamin D, the higher the cathelicidin level in your bloodstream. Cathelicidin will kill viruses, bacteria, fungi, and parasites. That's been proven in all kinds of studies. It will help you with influenza in the winter. For those of you who don't want to get a flu shot, I'm not going to advise you yes or no, but if you don't want to get one, you better take vitamin D in pretty high doses. Vitamin D actually has been proven to help with the flu with as little as 1,200 units a day for children. So it'll help prevent the flu in kids. It'll help with reversing partially autoimmune disease like Hashimoto's thyroiditis, and it will make a huge difference in cardiovascular disease. So if you want to prevent high blood pressure, strokes, diabetes, heart failure, chronic vascular disease, then high dose of vitamin D will help. You can reduce the risk of cardiovascular disease if you have higher levels by as much as 80%. And that's been proven in studies. So cardiovascular disease and chronic congestive heart failure and so on are all helped by vitamin D. So is type 2 diabetes. There have been studies now on type 2 diabetes. There have been studies on psychosis, early stage psychosis, and people who are having problems with mental illness. It's been found that their blood levels of vitamin D are much lower, particularly people with psychosis. People with cognitive decline. We're facing an epidemic of dementia and Alzheimer's in the next 10 to 15 years, and it's been found that those people who are at highest risk are the ones that have low blood levels of vitamin D. This was published in the Journal of the American Medical Association in September 8th, 2015, and I think the fifth estate forgot about this one. They also forgot about this one here, that vitamin D can help with all-cause mortality and cardiovascular mortality. Psoriasis. There are people writing into me and saying, oh, I read your book and I tried it for my psoriasis, and guess what? My psoriasis got better. Here's a study, a double-blind placebo-controlled study that shows that if you use vitamin D in high doses compared to a placebo, you can actually improve the quality or the severity of psoriasis. And what about leaky gut syndrome? Vitamin D is very important to help reverse, to some degree, the leaky gut syndrome, because it helps improve the connection between the cells. If it's too much of a gap, then you get a lot of things absorbed that you shouldn't. So vitamin D does help heal the leaky gut. It also seems to work for rheumatoid arthritis. Here's a study from a rheumatology journal. Another study that Fifth Estate forgot about. And most recently, it's been shown to increase muscle strength. So if you want to increase your muscle strength, if you're getting old and getting frail and falling all over the place, you better get on some high-dose vitamin D, especially if you're a woman going through menopause. And it's been shown now that vitamin D can help preserve healthy muscle, improve muscle strength in menopause. And just about everyone in this room is deficient in vitamin D. Unless you're taking it, you're deficient. There is no way you're going to be able to get enough vitamin D from sunshine in Toronto. You know, you can stand on top of your roof. Dr. Michael Hollick, who's one of the top researchers of vitamin D in the world, in January, he stood on his roof. He lives in Connecticut. And he took all his clothes off, which is kind of weird. And he measured his blood level of vitamin D before and after an hour of sunshine. And this was in the middle of winter. And he basically got 0 increase in vitamin D in his blood. So the angle of the sun is such that during the winter, your skin will not make any vitamin D. I don't care if you're skiing all day and you get a tan. That is not, you're not creating vitamin D. The only way you're going to get this in the wintertime is through supplementation. And the majority of people, who don't supplement during the winter are deficient in it. You can get a blood test done called 25-hydroxy vitamin D from your family doctor, and you could see what your level is. Now, further to that, this is coming from an epidemiology study done at the University of Calgary. And the researchers there found that you can reduce healthcare expenditures by as much as $21 billion a year if people were adequately nourished with vitamin D, between 2,000 and 6,000 units per day. So here we're looking at the top of the list. You can save about $5.2 billion just because of cancer. You can prevent that much cancer: cardiovascular disease, musculoskeletal disease, diabetes, MS and autoimmune disease, obstetrical problems, dementia, and even back pain. If you know anyone with back pain, get their vitamin D blood level checked. Guaranteed that they could benefit from vitamin D. So the cost of supplementing all Canadians at just 2,000 units per day would be about $250 million, but the savings would be well over $20 billion and result in less morbidity and mortality. And the cost of testing, by the way, Medicare won't pay for vitamin D testing unless you already have osteoporosis, kidney disease, malabsorption, or you're on a whole bunch of drugs that prevent vitamin D absorption. So the cost of testing would amount to $1.75 billion, but even there, if you factor that in, you're saving a lot of money on healthcare. So vitamin D basically reduces the risk of cancer, lowers inflammation. If you lower inflammation, you're going to live longer. It boosts the immune system and regulates over 2,000 genes. It seems to help with depression. So if you know people that get depressed during the wintertime, one of the major reasons is vitamin D deficiency. It seems to help with osteoporosis, prevents bone loss, and helps with autoimmune disease like MS and autism. Now, they did a study on vitamin D toxicity. This is from a toxicology journal. And basically they found that in a 15-year period, and there are lots of people now supplementing with vitamin D in very high amounts, and during that 15-year period, they found nobody that died from this. They found actually 3 people that died who tried to commit suicide with vitamin D. So if you take the whole bottle, yeah, you might kill yourself, but the amount of toxicity is virtually 0. And you can actually prove that by blood studies. Okay, the third most important thing is what happens in the bowel, your bacterial flora. Dr. Metchnikoff in the early 1900s was quoted as saying, "Death begins in the colon." And people that have a problem with what we call leaky gut syndrome, which is starting to become almost like an epidemic, will attest to the fact that probiotics or your bacterial flora balance is tremendously important to make you live longer. So what is a leaky gut syndrome? Well, the leaky gut syndrome is such that the gut is more permeable due to microscopic damage to the lining, allowing the absorption of undigested food particle toxins and microbes. So there's a lot of people that have a damaged lining to the gut, which allows things to get in that shouldn't. This is not the leaky gut syndrome. So autoimmune disease is the net effect of a leaky gut syndrome, because what happens, you absorb certain things and the immune system makes antibodies against these toxins, and these antigen-antibody complexes go around the body and they produce organ damage, and they produce these autoimmune type of diseases. So this is basically how it works. you could see the cells on the far left, those are normal cells, but then when you're exposed to antibiotics, microbes, various drugs like nonsteroidal anti-inflammatory drugs, various food allergens, genetically modified foods, all kinds of other toxins, then what happens is you create some damage between that junction between the two cells, and that allows toxins to get in, which then induce an inflammatory response and lead to autoimmune diseases. So that's sort of what happens. You get the leaky gut, and the leaky gut itself produces more food intolerances, which then produces more immune abnormalities that lead to autoimmune diseases. So here are some of the causes. Stress, certainly at the top of the list. We are all stressed. Hormonal imbalances, a lot of people with low thyroid, weak adrenals, and then of course toxins like mercury, lead, cadmium, arsenic, aluminum, fluoride, and so on. Drugs like antibiotics, steroids, and nonsteroidal anti-inflammatory drugs, or new sorts of aspirin in disguises. Various pathogens like candida and parasites, and deficiencies. If you are deficient in vitamin D, your gut lining will be damaged. And if you're deficient in amino acids, certain amino acids, which I'll get to in a minute, zinc, etc. And then if you're consuming a lot of grains, especially gluten, gluten tends to be pro-inflammatory, and so do high genetically modified foods and a high sugar diet. All of these things can damage the lining of the gut and lead to the leaky gut issues. And so here are some of the signs and symptoms. I mean, you may not recognize all of these in yourself, but a lot of people that have these conditions like digestive issues, bloating, gas, diarrhea, irritable bowel syndrome, about half the people that come and see me suffer from that. Seasonal allergies or asthma, PMS, PCOS, autoimmune disorders, chronic fatigue and fibromyalgia. Oftentimes you will see a leaky gut at the bottom of this. And certainly mood disorders, depression, anxiety, ADHD, ADD, and then skin conditions like acne, rosacea, eczema, candida overgrowth, and people that suffer from food allergies. I put this slide up because it shows a list of 18 different antibiotics that can be found in commercially available hamburger like you find at McDonald's. So you deserve some antibiotics today. Have that with your Diet Coke, and you wipe out all your flora. You wonder why people have poor bacterial flora? It's the things that they eat. It's the fluoride. It's all these chemicals. It's the pesticide. It's the GMO. It's the antibiotics in our food. And these are just some of the disorders that are associated with it. It's not just celiac disease that you get from gluten, but you can get all these other problems, including eczema, acne, urticaria, MS, you name it. Basically, all of these diseases originate from the gut. So I think Dr. Metchnikoff was correct. Death does begin in the colon. And so the reason for that is because 75% of our immune system is in the gut. We don't realize that the immune system is not just in our blood, it's in our gut. So all of these, there's a connection. So you may not see a direct connection between what's going on in your gut and the fact that you have rheumatoid arthritis, but there are now some studies that show a direct connection. So these gut microbes that we have, if we have too many Klebsiella, Citrobacter, Yersinia, Campylobacter, Helicobacter, and so on, all of these bugs eventually will cause autoimmune reactions and will lead to various autoimmune diseases. So what do we have to defend ourselves? Well, this is the third most important of the longevity supplements. They're called probiotics. The intestinal tract relies on live bacteria to help support a robust intestinal immune system. And some of the sources, I think many of the nutritionists, lecturers or naturopaths can tell you about this, but they include things like yogurt, aged cheeses, buttermilk, And things like pickles, sauerkraut, and sourdough bread, those are all high in friendly bacteria that could probably help your gut. Live microbial feed supplements. Also, you can take probiotic supplements. They will also improve the bowel flora. Okay, who wants to colonize my intestines? So there's lots of food out there. You can make some basic changes in your diet and get a lot of these friendly bacteria from food. Nowhere is this more important than in children. Probiotics, ADHD, and autism all have a connection to what's going on with your bacterial flora. I also wrote an article in Vitality a few years ago on probiotics, so if you want to look that up, you'll find all of the amazing benefits of taking probiotics on a regular basis. I think we should all take a probiotic simply because we're faced with an onslaught of chemicals, toxins, and doctors. So these are some of the factors that will affect your flora balance. I mentioned antibiotics, various infections if you drink contaminated water, for example. Highly processed and low fiber foods. All of these will actually kill off a lot of your friendly bacteria. So will aspartame, sucralose, all those artificial sweeteners. They will kill off your bacterial flora. If you have a chronic diarrhea condition from taking too much vitamin C or magnesium, you will also kill off your friendly flora. Chlorinated tap water, fluoride from your dentist, radiation, chemotherapy, and even colonic irrigation. If you're going to get colonic irrigation, I have nothing against colonic irrigation, but if you're going to get that, you better be taking a probiotic to make up for what the colonics have taken out of you. So probiotics reduce inflammation. You reduce inflammation, and you will live longer. Some of the reasons why the probiotics are important: they manufacture all your B vitamins, biotin, B3, B5, B6, folate, B12, and vitamin K. They also secrete various enzymes that break down lactose, for example. They are also anti-cancer, and they inhibit various bacteria that cause cancer. So they function as natural antibiotics. Basically what they do, they don't kill the candida, but they crowd it out. So if you crowd out candida, it can't replicate, it can't have an impact on you. So probiotics should be a part of just about every anti-candida program. And they help with elimination. They improve things like constipation, chronic diarrhea, even Crohn's disease, chronic inflammatory bowel disease. And they do help with bloating, gas, straining, and abdominal pain due to any cause. They also prevent skin problems. So if you know somebody with acne, it should help with their acne, or with the rosacea, eczema. They protect you against the adverse effects of radiation and pollution, and they oppose all the putrefactive bacteria. Now this is from Dr. David Perlmutter's book. He recommends the following probiotics: kimchi, sauerkraut, yogurt, kefir, kombucha, and prebiotics. Prebiotics are basically long-chain carbohydrates which feed the friendly bacteria. So they're known as prebiotics because they enhance your own bacterial flora. So they would include things like jicama, dandelion greens, garlic, chicory root, and Jerusalem artichoke. Inulin, for example, is a prebiotic. Any kind of fructooligosaccharide supplement is a prebiotic. So these are some of the conditions that it will help with. Autoimmune disease, obviously, mental health, candida infestation, digestive disorders of any kind, even osteoporosis. Skin health, of course, allergies, protects against radiation, stabilizes your blood cholesterol. They've done some studies to show that when you take a probiotic supplement, you will actually help lower your high cholesterol levels. It enhances fertility and aids in weight management. A lot of people that have trouble losing weight, sometimes it's not because of the caloric intake, sometimes it's because your probiotics are out of balance. You just don't have enough to help metabolize or digest your food properly. So it helps with weight control. It prevents periodontal disease and seems to protect against the so-called supergerms. Here's a study that was published that showed how basically artificial sweeteners will destroy your gut bacteria, lead to gut flora imbalance, and thereby lead to autoimmune disease, cancer, and all kinds of chronic inflammatory conditions. Could gut microbes help treat brain disorders? Mounting research tightens their connection with the brain. There is a deep connection between the gut and the brain. So if somebody has a brain problem, look in the gut first. And this is a good reference for this, a book called Brain Maker by Dr. David Perlmutter. And he talks about the power of gut microbes to heal and protect your brain for life. So this is a very important supplement to be taking if you want to increase your lifespan. This fellow is not taking probiotics. Gerald converted the barbecue grill to natural gas. So unfortunately, he has a bacterial flora imbalance. So colon cancer, cholesterol, blood pressure, all of those things can be helped with probiotics. Just about anything, it seems, can be. If you look at the gut, you can make a huge change in a person's health. Okay, moving on. Vitamin K2, it reduces the risk of dying from any cause by as much as 36%, according to one study. Vitamin K2 consumption helps reduce the risk of hardening of the arteries. It prevents deposition of calcium in the arteries. People deficient in K2, tend to get more hardening of the arteries than people who aren't. And vitamin K2 is not only important for cardiovascular problems, but also for osteoporosis, diabetes, and cancer prevention. So if you mix vitamin K with vitamin D, and there are some supplement companies out there who are making a vitamin D and K2 supplement, that's the best kind to get if you're going to get vitamin D. It seems to be much more strongly anti-inflammatory. It downregulates the inflammatory cytokines in the dose somewhere between 100 and 300 micrograms a day. And Life Extension magazine in 2010 wrote a great article on how vitamin K2 has anti-cancer properties. So you can go to the Life Extension Foundation website and in their search engine put in vitamin K and you'll find tons of different articles on that. The next one is vitamin C. We all know how important vitamin C is from Linus Pauling, who was panned heavily on the Fifth Estate. They didn't like Linus Pauling. He only won 2 Nobel Prizes. Major benefits of vitamin C are on the immune system, the cardiovascular system, and the musculoskeletal system. Bones, gums, and teeth can all be improved with vitamin C supplementation. And deficiency predisposes you to infection, impairs your ability to heal from traumatic injuries. The usual recommended dose for adults between 2,000 and 4,000 milligrams a day. But you've got to watch vitamin C because if you take too much, you'll get loose bowel movements, which for many people living in Toronto is a blessing. Okay, the Marketplace show, which is not going to be aired, but was going to be aired, they took it off the air for some reason. They weren't going to play it. I don't know why. But they had a bug up their ass about Energen C. Energen C is a powder form of vitamin C that people take to improve their energy. And what they claimed on the show was that the product did not contain what they said was on the label. And they did some sort of studying which was the wrong kind of study to measure the amount of vitamin C in the product. If you look at this slide, this is from Consumer Lab, and they found that Energen C contained 100% of what was actually advertised to be on the label. So, to make a long story short, this product is a legitimate product. It's not bogus as the Fifth Estate or Marketplace is claiming. And vitamin C is one of the most important of all our antioxidants because when you expose cancer cells to very high doses, high-dose intravenous vitamin C, now we're talking here about 50 to 75,000 milligrams of vitamin C per IV infusion. If you swallowed that much, you'd have diarrhea for the next 10 days. You cannot possibly absorb that much through the gut. So when you give it intravenously, what it does is it increases the peroxide in the system. Peroxide is toxic to cancer cells. So vitamin C intravenous has been used as a very effective treatment for many different kinds of cancer. And contrary to what the oncologists tell you, I disagree with a lot of oncologists, they tell you that you shouldn't take vitamin C or any antioxidants together with chemotherapy. Well, studies show the exact opposite of that. Studies show that people who take antioxidants together with chemotherapy live longer, have fewer side effects, and basically do better than patients who don't take them. Met him in the hospital where we both volunteered to take part in a clinical drug trial. Fortunately, I got the placebo. I have patients asking me, should I take this drug trial? Well, sometimes I show them this slide. Depends on my mood at the time. Okay, moving on. There are certain amino acids that are tremendously important to make you live longer. And Linus Pauling and Matthias Rath, two MDs, heavily promoted, and so does Dr. Gifford Jones. I don't know if you've ever heard Dr. Gifford Jones speak. He talks about the importance of combining vitamin C with L-lysine, which is an essential amino acid. It makes more carnitine in your system, and as some of you may know, carnitine is very important for the heart, important for your muscles, important for strength and for longevity. It's also important for the brain. So taking L-lysine will do a lot to benefit you. The usual dosage I recommend is between 1,500 and 3,000 milligrams a day. And no, you don't just use this for herpes, although it does seem to help with herpes. You can take it on a regular basis. Combined with L-proline, another amino acid. So you can take this. This is very important for skeletal muscle as well. Athletes know this very well. It helps build more collagen and cartilage. And if you take it together with L-lysine, it helps make more collagen. Essential in the skin to make it look younger and enhance longevity. So the ideal dose here is between 500 and 1,000 milligrams a day. So that's a very important one as well. So is L-glutamine. L-glutamine, best known as the non-essential amino acid that helps build bigger and stronger muscles. So you see a lot of athletes, a lot of people that go to the gym and want to have better muscle definition, want to look sexier for their girlfriends or whoever, I don't know. It seems to help improve muscle strength. It is the primary nourishment for the entire GI tract. So the body uses L-glutamine to repair damage to the GI tract. So remember I said the vitamin D is important? Well, vitamin D and L-glutamine and probiotics together are very important to help heal the leaky gut and help heal the lining of the GI tract. So it is something that will heal things like ulcers. People that have ulcers or who have esophagitis or gastritis, diverticulitis, all of those conditions can be helped by L-glutamine. And if you take it between the hours of 10 at night and 10 in the morning, it will help you increase your own production of growth hormone. So this is another reason why bodybuilders are using this, because if you use growth hormone, that tends to increase muscle strength and stamina. And for men out there who have a problem with things like erectile dysfunction or low libido, L-glutamine will help boost up your growth hormone levels, which will help all those conditions. And it seems to help improve concentration, alertness, and interestingly enough, it helps you stop your craving for the wrong kind of foods. I've given this to people that can't stop eating sugar, can't stop eating bread, can't stop eating pizza. And if you take enough of it, anywhere from 5 to 15 grams a day, you will be able to control your appetite for the wrong kind of foods. Pardon me, but I couldn't help notice how well behaved your children are. May I ask which medications they're on? This is my way of saying that, unfortunately, many kids, I think somewhere around 1 in 7 or 1 in 8, in this country and the United States are on things like Ritalin or Concerta or Adderall or any of this whole class of amphetamines. Amphetamines are speed, okay? So to make kids behave better in school, you give them speed. That doesn't make any sense. It seems to work. However, there are better ways of dealing with this. So obviously, diet is very important. Reducing inflammation in the brain is very important. And you can do that naturally. You don't have to use amphetamines. One of the things that you can use is another amino acid called L-threonine. This is nature's chill pill. It not only helps the immune system, but it calms the brain. It prevents anxiety, inflammation in the brain, poor memory. So it's useful for ADHD, anxiety, insomnia, depression, and panic disorders. So I took lots before I came here to lecture to you. Seriously, I did. It's helpful for irritable bowel syndrome, spastic colon, celiac disease, and just about any kind of gut problem. And citrulline. Okay, this is nature's Viagra. What it does is it makes the body make more L-arginine. L-arginine increases nitric oxide. Nitric oxide is a vasodilator, so it'll do what Viagra does. Opens the arteries, improves erections, improves circulation in general. So L-citrulline in doses of 500 to 1,000 milligrams has a long-lasting effect. So it's something that you can use without any significant side effects. Never really seen any side effects with L-citrulline. Can you help my friend? I'm reaching out on behalf of a friend of mine who needs some help, who wishes to remain anonymous. His wife told him to go out and get some of those pills that would help him get an erection. When he came back, he handed her diet pills. Anyway, he's looking for a place to live. Some of you got that, okay. Okay, another very important amino acid that produces a longer life is L-taurine. It's been found that Japanese men and women who have a diet high in L-taurine can live to the age of 100 and beyond. So it seems to have some kind of special power in terms of a longer life. It helps with macular degeneration or eye health. It protects the nervous system. So anyone suffering from peripheral neuropathy, tinnitus, epilepsy, any kind of nervous disorder, cardiovascular problems, particularly high blood pressure. I've seen some amazing things using high doses of taurine for high blood pressure. It will actually help lower it. It also seems to help with insulin resistance, diabetes, and metabolic syndrome. So it's a very important amino acid. And I mentioned carnitine before. Lysine helps make more of this N-acetyl L-carnitine. Carnitine is something that boosts the energy in the mitochondria of all cells. So it's particularly important in neurological problems, memory depression, cardiovascular disease, Parkinson's disease, and strokes. The primary source is from red meat, but you can also get it as a supplement. And if you take too much of it, you may get some abdominal pains, but most people don't get any side effects with a dosage of 500 to 1,000 milligrams a day. So now we've arrived at middle age, that time when you finally get your head together, then your body starts falling apart. So what can you do? Well, you can take some of these supplements, especially 5-methyl tetrahydrofolate. Folate, that is the active form of folic acid. When you see folic acid written on a supplement bottle, don't buy that one. Buy the supplement bottle that says 5-methyl tetrahydrofolate, 5-MTHF, because folate prevents the buildup of homocysteine. Homocysteine is toxic. If you get too much homocysteine in your system, it tends to increase hardening of the arteries. And you can see folate deficiency by what's called hypersegmented neutrophils. So those are a type of white cell. They shouldn't have lots of segments. They should have no segments. So if they have multiple segments, that's a sign that you may have a folate deficiency. You can see this on a blood film. and you could see it on live cell microscopy. It's one of the reasons I do live cell microscopy. I'm looking for this deficiency. And this deficiency, if you have it for too long a period of time, it'll produce all kinds of neurological damage. And 1 in 3 people seem to be born with a defect. They cannot convert folic acid into folate, which is the active form. So that's why this particular vitamin is so important. And of course, vitamin B12, I can have a lecture on just vitamin B12, all the things that it can do. But it's very important for the brain, the nervous system, the liver. As you all know, if you're too long deficient in vitamin B12, you'll end up with pernicious anemia. The best form of vitamin B12 is the methylcobalamin form, because that's the kind that gets into your nervous system the best and produces the best results with things like numbness and tingling and sensation problems, poor vision, burning sensations, muscle cramps, neuropathies, and so on. And it basically is needed to keep homocysteine levels from going too high. So it's another one of these what are called methyl donors, so it prevents too much homocysteine in the system. The recommendation is about 1,000 micrograms a day. That's like 1 milligram a day. And you can take that under your tongue. You can get it in liquid form. You can get it injected if you like. And a lot of rats these days are using it because, as this researcher says, I'm sorry, we have a hiring freeze on the lab rats are living longer and longer. So another very important anti-aging or longevity supplement is selenium. Trace amounts are known to help prevent cancer and heart disease. Very important for thyroid function. So people that have a thyroiditis, have elevated antibodies in their blood against the thyroid, often will be deficient in this mineral. So taking the mineral will help control those antibodies. If you eat 2 Brazil nuts a day, you'll get about 200 micrograms of selenium, which is the recommended amount to take per day. The maximum safe dose appears to be only about 600, but I've known some people that have taken multiples of that without any toxicity. Very effective for thyroiditis and other autoimmune disorders. Okay, magnesium. Some people argue this should be higher on my list of longevity supplements, but it's debatable. I think magnesium is tremendously important. It is a very common deficiency. It's very important if you're treating osteoporosis. A lot of people think calcium is only important, but magnesium may be more important, certainly for cardiovascular problems, circulation problems, blood pressure, strokes, prevention of diabetes, spasms. If you have a spasm in your system, you're magnesium deficient. If you have spasm, you can correct it by getting adequate amounts of magnesium. So it's something that will help prevent anxiety, panic attacks. In fact, there's a type now that's just became available in Canada called magnesium threonate. So if you're nervous, anxious, have memory problems, taking a combination of magnesium and threonine together will actually improve brain function to the point where it can, you can get a really good result in anyone suffering from dementia or any kind of memory disturbance. Magnesium has been called nature's calcium channel blocker, so it will help with angina, high blood pressure, peripheral vascular disease. And there's several forms. You got to remember that different forms of magnesium will have different effects. So for example, magnesium citrate and oxide, magnesium oxide, will cause your bowels to move much quicker. So if you have a constipation problem and you need dynamite, use either magnesium oxide, magnesium peroxide, or magnesium citrate. And don't say it didn't work, because if you use enough of it, it always works. So some people may need 1,000 milligrams, some people may need 5,000. Everybody's a little bit different. Depends on how much dynamite you need. So then there's also a magnesium bisglycinate. Magnesium bisglycinate absorbs better through the GI tract and is less likely to cause diarrhea. And then there's magnesium threonate, so you want that particular one to get into the brain. The magnesium bisglycinate does not get into the brain as well as the threonate. Something about the threonate carries it to the brain, improves brain function. And now you can also get the same benefits by getting intravenous, but most of you don't go around with the IV stuck through your arm. So it's easier to take the magnesium threonate. These are some of the sources. I was quite surprised to see that kale was on the bottom of the list. I used to think that kale had a very high magnesium content, and it does have magnesium in it, but compared to seaweed, seaweed seems to be the highest source, 770 milligrams per 100 grams. Coriander is second, pumpkin seeds, cocoa. How many here crave cocoa? You probably crave magnesium. Basil, flaxseed, cumin, Brazil nuts, parsley, almond butter, cashew nuts, whey, and leeks. And kale's at the bottom of the list, but kale has a lot of other benefits I'm sure you've heard. So magnesium threonate, it helps the nervous system primarily. It does this by basically healing any damaged synapses. So synapses are basically the connection space between two nerves. So if a nerve wants to communicate with another nerve, it has to send a transmitter across the synapse. So now if those synapses are destroyed somehow, that can't happen, and so memory is affected. So what magnesium threonate does is it heals those broken down synapses and actually increases the number. So the more synapses you have, the more likely it is that your memory will improve. Magnesium is wonderful for restorative sleep. If any of you are having any problems with sleep, try magnesium threonate. And you probably should take close to 1,000 milligrams before bedtime. And it supports cognitive and neurological health and supports stress management and a healthy mood. Okay, one thing I wanted, this is like an aside here. I put this slide up because I knew that a lot of people had watched The Fifth Estate, and they were using this particular thing called DNA barcoding as a way of saying that supplements are legitimate or illegitimate. Well, when you take a whole herb or a powdered or freeze-dried herb or whatever, it has a DNA sequence. So what this researcher or what they were saying on TV was that they looked at bottles of supplements and it didn't have the DNA barcoding that was in the actual plant. And that's true because when you make a supplement, what you're doing there is you're extracting from the plant the active ingredient. Now that doesn't have a DNA barcode. So if you're saying that a supplement is illegitimate because it doesn't have a DNA barcode the same as the plant, then you're incorrect because it's not the same thing. So basically you're not measuring the same thing that you're claiming to. So this is, if you ever hear this again, you will know that this is a bogus way of testing for the authenticity of any kind of nutritional supplement. So healthy aging, 5 years after a period of daily supplementation with antioxidant nutrients. So they say that these supplements are not effective, but according to this study published in the American Journal of Epidemiology in September of 2015, they concluded an adequate supply of antioxidant nutrients, equivalent to quantities provided by a balanced diet rich in fruits and vegetables, may have a beneficial role for healthy aging. So these things do seem to help with aging and preventing premature death. So these are my top 10. Once again, glutathione, vitamin D. By the way, it's always vitamin D3, probiotics and prebiotics, vitamin K, vitamin C, and then the key amino acids, lysine, proline, glutamine, threonine, citrulline, taurine, and acetylcarnitine, 5-MTHF, vitamin B12, selenium, and magnesium. And when you take all of these, you're going to live forever. That concludes my prepared remarks. I will now evade your questions. Yes? The lady says there's no way you can take all of these things as a pill in one day. I would totally agree with you, but there are companies out there. There's one called Pro Longevity, made by NACA, that has all of these in it. There are other companies that are making similar products. I think one of them is Medici Plus. That's what Dr. Gifford Jones has been lecturing about. There are going to be more and more of these supplements on the market in the coming years. And they're all in either powder form or liquid form. So you could just mix them with water and just drink it down a couple times a day. You can go to my booth, you can see the product there. What's my booth number? Anybody know? 101. Thank you. Yes?
So I know somebody that has heavy metals in their body.
Right.
And they were told to have them chelated. If you were to take these supplements, would you still recommend that they get a chelation?
Excellent question. If somebody has toxic heavy metals in their system, do I recommend, the question was, do I recommend chelation therapy if they're taking these kind of supplements? Well, if you take glutathione just by itself, glutathione has a lot of sulfur in it, and it will bind just about anything, any toxic heavy metal. So you could actually take this now as a way of doing oral chelation. The other thing I would highly recommend for anybody that has toxic heavy metals is to get into a far infrared sauna several times a week. Far infrared sauna removes more toxic heavy metals and more toxins than any single treatment. It beats intravenous chelation hands down. Now, intravenous chelation is probably more beneficial for diabetics that have hardening of the arteries and cardiovascular disease. So it's not my first choice in chelating or getting rid of toxic heavy metals. Yes?
Do you think everybody should be vegan or vegetarian? Or depending on, their body type or what have you?
Yeah, do I think that everyone should be vegan or vegetarian? As I think Julie Daniluk is lecturing next door, you can go there if you want. She's talking about 7 billion diets for 7 billion people. Everyone is unique. We all have a biochemical individuality. Some of us do well with meat, but if you're going to eat meat, eat grass-fed organic beef. If you're going to eat fish, eat it less often and take lots of glutathione or chlorella or something with sulfur in it because of the mercury. If you're going to eat chicken, make sure it's organic as well. So everybody's a little bit different. So some people do well with meat, some people don't. I know lots of people, if they have a little bit of dairy products, they have diarrhea for 3 weeks. So, we all have biochemical individuality. Yeah. Yes?
Hi. This prolonged longevity by NACA, is this safe to take if you're taking Coumadin?
Well, it is not safe to take when you're taking Coumadin because it has vitamin K in it. So people that are on blood thinners have to be careful with these supplements, particularly with vitamin K, because that works against Coumadin. It doesn't work against the other blood thinners, the latest ones that have been marketed, but it does work against Coumadin or warfarin. Yes? What was your question? I'm sorry. How do I know if the supplements are absorbed by the body? Well, you can get various biochemical tests before and after. So you can do blood tests, for example, for vitamin D, swallow vitamin D 3 months later, see if the blood level went up. You can do that for virtually all the nutrients. There are many different ways of testing for this. Some people use blood tests, some people use urine tests, some people use hair analysis, some people do other types of analyses. So that's how you know. Yes? Well, yeah. What the company said about that is that they were testing expired products. On every bottle, there's a little expiry date. So obviously if you're going to test something beyond the expiry date, it's going to be rancid. That's right. If it's before the date, it should be okay. Now, what I suggest you do, if you're concerned about that, go to a website called consumerlab.com. And you can subscribe to that. And they do independent testing. They're not a vitamin and mineral company. They have nothing to do with making profits off of supplements. And consumerlab.com does independent research and tests every single bottle of every supplement on the market. and makes comparisons between different companies. So then you will know what percentage of the particular supplement is in the capsule. Yes, in the back. K3 is synthetic. Yeah, K2 is natural.
Because I recently read if you want your calcium to go to the proper places, like inside your bones and not lodged inside the organs, that you have to supplement D3 with K2. And now,
That's correct, yes.
so forget about K3 because it's synthetic or it works the same.
I wouldn't be taking K3. You need a prescription for that one. Okay? Yes, in the back.
In your top 10 list, you don't mention digestive enzymes. Do you have any comment on that?
Yeah, that would be number 11. No, in actual fact, you're quite right because a lot of people, as they grow older, their production of various enzymes from the pancreas goes down proportionately. So the absorption of things like zinc and vitamin A and so on are inhibited. So taking digestive enzymes is a very good idea. Yes.
For probiotics, what's the daily dose that you recommend? Is it splitting it or just taking it once a day?
Well, for probiotics, I usually recommend once a day. In some people that have severe digestive problems, twice a day, always with food. And I recommend between 15 and 45 billion cells per capsule. Yes.
Hey, I gotta ask you, I'm in health nutrition. I'm a 23-year veteran with TTC. And I've noticed a lot of my coworkers at their age, they just kind of have no knowledge about menopause, andropause. What's your opinion on low testosterone? If you had a deficiency in testosterone to improve your quality of life or well-being, if you're under doctor's care, deficiency, you've seen your endocrinologist, you know the symptoms and all that, what's your opinion on that? Would you...
That's a very good question. That's number 12. And that's something that is totally ignored by conventional medicine. I'm a member of the American Academy of Anti-Aging Medicine. I got into it because I was aging. And yeah, I'm an old guy. So in any event, I use a lot of bioidentical hormones in my practice. I find a lot of men, once they reach the age of 35 to 45, the amount of testosterone that they're producing disappears almost. We have a lot of infertility in this country. We have a lot of men who have diabetes as a direct result of low testosterone levels. Cardiovascular disease is oftentimes associated with low testosterone levels as well. They recently did a study on 83,000 veterans, and they found that for the veterans that had a low testosterone level, if they gave them enough testosterone to bring them up to a normal range, the incidence of diabetes, heart disease, strokes, high blood pressure just plummeted. So there is a direct connection between your testosterone level and how long you're going to live and how sick you're going to be. A lot of people think that testosterone is a bad thing. Well, just remember when you were 21 years old, compare your testosterone level then to where it is right now. At that time, you were the healthiest you were in your entire life. So how could testosterone be bad for you? So I'm a great believer in using bioidentical testosterone to increase your lifespan. Yeah.
The reason why, because I'm 53 again, I'm not, how could I say this? I've had 5 friends I spoke to being health nutritionists. I said, guys, your lifestyle is brutal. Get some health tips about nutrition, diet, exercise. Out of the 5, in the first 3 years, 4 died, heart attack.
Yeah.
The 5th person was my best friend, had a heart attack, didn't talk to me. I went to see my cardiologist about 3 months ago to see if there's any plaque buildup in my arteries for heart attack and stroke. Not that I've ever smoked. I was always a clean eater. After the tests, he was saying you've got the heart of a 35-year-old. So he said basically you reverse the aging on the inside and 23 years of TTC. And if you people all take the TTC that you all know, we have a really bad performance in customer service because people don't realize the male mood swings that we go through known as andropause. If anybody's ever taken the TTC from TTC, this is the reason why a lot of us could be want to be mean to you. Just men are in denial about your health. And as you get older, great, you're just smarter. So,
That's right. You don't want to be a grumpy old man. And testosterone has a lot to do with it. And you could increase your own testosterone level by exercising, by eating this way, anti-inflammatory diet. And, there's lots of things that you can do in addition to getting a bioidentical hormone supplement.
had deficiency.
Yeah.
Did the blood work and I said to my doctor, let's go for it the whole 9 yards. And I've never done drugs in my life. And when he gave me the testosterone under doctor's care, I didn't use it because I thought it was strictly for building muscle. And I've never done drugs in my life. And I'm starting to feel difficulty in my life with my job. So once I started doing it, I did research on testosterone. A man's not a man without testosterone. Too low can cause serious depression and suicide, correct?
Absolutely.
Too much
Yeah.
high, as in bodybuilders,
Mm-hmm.
heart attacks.
Yeah. So you have to have a sort of an optimal level. I totally agree.
Three months, I get my blood work, I get my shots in my butt every week I switch. It's, guys, get in the zone, be a man and wake up. Don't be scared to, give me the quality of your life and your relationship, correct?
Good advice. Absolutely.
Thank you.
Yes.
I have a question about CoQ10 actually, and it's not part of your discussion today, but it's about the two forms of ethanol.
Okay.
You said, just let me get to the part of it. You
Okay.
said that they're both fat soluble, so there's no difference in absorption rates.
Okay. Ubiquinol is better absorbed than ubiquinone, but if you take it with food, you take the ubiquinone form with food, you get the same level of absorption. Now, in the bloodstream, ubiquinone converts to ubiquinol and vice versa, depending on what tissue requires which form. So, ubiquinone is 30% cheaper than the OL form. So, cardiologists like Dr. Steven Sinatra recommend that you use the ONE form, and that's the one I recommend too, just because it's a lot less expensive and you get the same result.
Great. What I wanted to ask was, do you think the freely converting between the forms still occurs after 50 in men?
I think it does, yeah. As far as I know, all the research was done on using the ONE form, and it shows a lot of tremendous benefits with that form. So there's no direct comparison between the two different forms. No study has ever really been done. It's just basically they're saying, well, it's the OL form, and then in mice it absorbs better, so therefore it must be better for humans too, and I disagree. Yes, in the back? Is plastic bad for the food? Sure it is. You get all kinds of chemicals impregnated into the food, some of which are they work like estrogens. And they basically make men fat, to give them breasts, and cause prostate cancer, just to name a few. Yes, ma'am. Oh, the optimal level for vitamin B12 in the blood test? Well, they say it's over 250, but I like to see it much higher. Most people over 500. Blood tests are not very sensitive for vitamin B12. You can still have a normal blood test level and still be deficient, and I've proven that in many people where I give people with normal B12 a high dose, and it improves things like their energy or their thinking or their moods or whatever. So the blood test is not very good. How do I measure? Well, usually by what we call trial therapy. That's what a lot of doctors do. They give you a shot of B12 and they see if you get better. And if you do, you do. That's great. Yeah.
In your recent article in Alternatives, you recommended 1,500 milligrams of magnesium threonate per day.
Yes.
Effective magnesium dose of 600.
Yes.
Take that higher dose to get the effects of magnesium.
Well, that's right. We don't know the optimal dose of that yet, but I'm kind of estimating based on the animal studies. So I think maybe about 1,500 milligrams of threonine, about 600 milligrams of magnesium. Seems like a reasonable amount, as long as it doesn't produce diarrhea. I think the only side effect could possibly be diarrhea, but I haven't seen that yet in people that I've recommended it to. I recommended it to a friend of mine and who couldn't sleep, and he sleeps so well now. It lowered his blood pressure and everything else, so it seems to make a big difference there. Yeah. Should seniors take a higher dose of vitamin D3 or not? Well, it all depends on their blood levels. My usual recommendation for any adult living in Canada, if they're not supplementing, is about 10,000 international units per day. And I will check blood levels periodically. Anything under 30,000 a day is very safe. Dr. Weeth at the University of Toronto recommends that you take minimum 4,000 to raise your blood levels, and he's never seen any toxicity with 10,000 international units or less. And he's one of the world authorities on vitamin D. Yes?
What's your opinion on berberine?
Oh, berberine. Berberine has multiple uses. Berberine will help control your blood sugar levels just as well as metformin. One study showed it to be equally good to metformin, which is an anti-diabetes drug, so it will help lower your blood sugar. Berberine is also a natural antibiotic. It will help kill off just about any kind of bug. It's very useful for any kind of gut problem. It'll kill off any bad bugs in the bowel, so people with irritable bowel syndrome are helped by that. So I think it's a very useful supplement.
So if someone takes it, do you recommend taking a probiotic
Yes.
later in the day, or?
Yeah, I would take it at a different time. Similarly, if you're taking oil of oregano, take it at a different time from a probiotic.
In terms of time-wise, after 4 hours?
About 4 hours, yeah. Yes? What improves your hearing? I think one of the things that I mentioned here, taurine, that one will help your hearing, but all the antioxidants will. Improving your adrenal glands will help your hearing as well, so using an adrenal support supplement is helpful too. Okay, I'm going to be up in booth. Oh, one more question, yes.
Just very quickly, you said at the outset of the presentation that if we want to get a couple of the slides that you used to present,
Right.
I was curious if there's a fee for that.
Sorry?
Is there a fee?
No, there's no fee for that. What I do is I just send me your email address, and I use Dropbox. I put it in Dropbox, and I just email it to you from there. Okay? No problem. Thank you very much. You've been a very great audience. Thank you.